Welcome back to my channel. I'm Latrice Kelly. If you're new here, this channel usually focuses on cooking and food videos, grocery hauls, shopping hauls, sometimes health related content. Today's video has been 6 months in the making. This is a progress video that follows how I'm recovering from my patella fracture surgery. That's basically a break in the kneecap. I'm sitting here in my kitchen. This is the place where I injured myself literally 6 months ago. And it's been a fight to get back to my sense of, quote, normalcy. So I figured today would be a good time to share where I am with things and journey back through everything from my day in the hospital, from surgery, coming home, and then recovering in terms of going to physical therapy twice a week and fighting for this knee to go back to where it was. And if you are someone you know has this similar injury, this video is definitely for you. I also want to give you some quick background about me so you can have an understanding of where I am with this injury. So during my surgery, there were no wires or screws installed. Please pardon my Instapot beeping in the background. I had no wires or screws installed. I have a comminuted fracture of the right patella displaced. Basically was broken into 4 or 5 places. How my surgeon put it back together without screws or wires is a medical mystery. I think my doctor is just a rock star, and my body is also a rock star because we were able to get things on the mend without intervention or installation of hardware. So I have never had a broken bone or fracture prior to this injury. And again, I was hospitalized the day after my accident and had the surgery the following day. I spent 6 weeks immobilized, meaning I'm in a brace, and I was not able to weight bear or bend my knee for 6 whole weeks. So that meant recovery at home, having people helping me. I had in-home care with a nurse who basically showed me how to use my walker and get from my bed to the bathroom, and then later learned to use crutches, so when I had to go to doctor's appointments, I could leave my home. So I'm not a doctor, I'm not a medical professional, but I'm simply showing you what worked for me. What worked for me may not work for everyone. Always consult your doctor, your medical team, your physical therapist, and other medical professionals for the best advice. I'll probably do some voiceovers here and there in the video, probably not the whole thing, but if you have questions about anything you see, any of the exercises that my PT did with me, any of the procedures that they showed me or did with my knee to help me get back, I'm free to answer all those in the comments. Thank you for watching this video, and I hope it's of some benefit to you. Following 6 weeks of immobilization, I returned to work on a very limited basis. I highly recommend you get a fanny pack and attach it to your walker because it makes it easy to put your cell phone and other effects in there so you can have easy transport. So this is me at home. My husband helped me change my bandages when I came home from the hospital, and you have to keep your wound clean, your site clean, and the dressing. So that's what that is. And here I am at, I believe, my 6-week check-in after being on bed rest and immobilization with the ortho, who is giving me a new brace. Here is the start of physical therapy. This is one of my very first office visits, and I have a very highly capable and wonderful team who I adore, who have been helping me recover and rehab this knee. They are now preparing my leg to be hooked up to a stimulator, which basically helps the atrophied muscles and tissues get back active again, because of course after 6 weeks your leg becomes very listless, you lose power, you lose strength. So we're cleaning the area, and then we're going to get hooked up with the different stimulator pads. And when I feel the little stinging or kind of like snaps of almost electricity, that's when I know it's time to try to raise my leg up and do the exercise to bring my leg back into the game.
And then we're going to be watching for the muscle contraction analysis. And then we're going to start it. So it's going to go down, and then it'll ramp back up.
What thing?
And then you're lifting when you feel that strong sensation. That was what they told you to use in PT school. Not electricity, a strong sensation. In school, they don't want us scaring our patients. They tell them that we're hooking them up to this electrical torture device. And then it's gonna go back on, straighten that knee, straighten, hold for about 5-6 seconds. And it's coming back. She had 34 for amplitude today, so it's better than it was last time. You put yourself in just like the perfect.
I know.
Framed it nicely.
Oh, good. Husband, you've been helping me with this janky knee, and so I was so excited. I texted him. I was like, I took a bamboo.
That's a big milestone.
It was. I was so
Put
scared.
it in your notes.
I was so scared. I was like, I can do this. I'm like, I'm bending my knee and
Able to act like a big girl.
You can get in this tub going and fall.
Let's see what we can do with this knee. We're good at straight. Like we can do straight.
That's fine.
Bend your knee as best you can.
Okay.
Let's see. Bend it, bend it, bend it, bend, bend, bend. Slide it, slide it, slide it, slide it.
I'm not stepping a sheet up. Right?
You were,
Okay.
but I tried to hold it and get it past you.
Okay.
So, now you're about 44.
Why does it hurt?
Because it's been so stiff.
Here we go. You gonna be mean today? Yep, you gonna be mean. I can tell you. Let me brace myself. Hold on. Breathe in.
Scoot over towards me a smidge.
This is the point in which my therapist is going to be very deliberate and forcefully kind of pushing a bend into my knee. He's being very encouraging while doing it. It looks strenuous. It did hurt, but this is part of the recovery process. Pain is also going to be involved. Thankfully, he's really soothing my leg. You can see him giving me a little massage in between him lifting and lowering the knee and bending it.
Come on, you have babies. This is nothing compared to that.
Are you kidding?
This is just.
I think I'd rather have another baby.
No way. This is just
I'm so
active.
Serious.
This is just the most present thing in your memory.
The baby has a purpose. Pain.
This has a purpose.
Yeah, this pain has a purpose. You want to walk again?
I guess. Damn.
Get in the tub every day by yourself.
By myself. I know.
All right, let's go again.
Okay, breathing.
Keep breathing. Don't hold your breath. Don't hold your breath. Good job. Because I don't think else is going to push as hard as I am.
Thank you.
Sorry, my watch.
That's okay.
That's the least of her worries. Keep push. And now take some pressure off. Good job. You just hurt your first patient. You should be so honored. You're going to do that a few more times. Oh,
I know,
okay,
I'm gonna
okay.
take off my watch. I don't want to hurt her more than she has to.
The next exercise is knee cranking. My therapist is going to literally push up and down on my leg like I'm a water well. So if you're squeamish, the end of this exercise was not pleasant for me. You might want to fast forward. So fair warning, but this is part of the process. Scar tissue will get broken sometimes during physical therapy. And it sounds painful because it actually is painful. I'm breathing.
That's good.
I'm still here.
Sweating yet?
I'm sweating a little bit. A little shine.
If you need a break, let us know. All right? Need a drink of water or something?
I can wait to have a drink of water. All right, you pushing down.
I'm pushing.
Yikes, yikes, yikes.
Here we go.
All right, we are at the 10:38 timestamp. Fast forward to 11:02 if you want to avoid this part that's coming up. I'm telling you, it hurt.
Okay, so focus on your breathing. Big deep breath in and exhale. Okay. You're good.
No.
What happened?
Oh my God. I am wearing a dress in physical therapy because pants and jeans kind of hurt my scar. I had on some little shorts underneath, but this is a pedal bike exercise. This helps get the knee cranking again and bending. You'll see at the 12-minute mark how we use the plunger and deep tissue cream to help with scar tissue. I am doing a happy dance. I got 80 degrees of bending today in physical therapy. That is amazing. That is amazing. Like, it may not be amazing to you, but it's amazing to me. Functionally, I'm not even 50% back, but the fact that my knee is repaired, but we got to let the healing take place. I've been immobile for so long. Today I needed a win, and I'm just glad today was that day. Hey, now go me.
Very scientific. It's with the special sauces.
That's the special secret for making your knee flex.
You're bending a little. It's still a resistance. It's not as much resistance. I don't know if that makes any sense.
Physical therapists have so many tools at their disposal for helping you recover. So this plunger thing is kind of funny, but it actually does work. The days where we use the plunger, I had more range of motion when I left from my appointments. So your girl walks like a pirate. Sue me. This is very much the challenge of physical therapy, learning to rewalk and use the muscles again, you know. So again, we're using all the tools at our disposal. This is a needling procedure, and it helps to address scar tissue.
Which trick works the best, you know?
Oh, we had to try some of everything with me. Good gravy.
All right, here we go.
Removing it.
Yep. So it's not that it was in this way. It's more that it's going to come across that way because it's going to look kind of long on camera.
Thanks. Wow, it does. That is crazy.
So not that it was in you, it was in.
Here are some simple standing desk exercises to do. I also did these at home in the kitchen, at my bathroom sink. Remember, my right knee is the one that's affected. You can see how limited my range of motion is, and that's why it's so important to keep bending it. Trying leg lifts, doing side to sides, rocking back and forth, calf raises. All these things help bring that whole kneecap situation back together by working my thigh, my leg muscles. It all is a coordinated game and effort to help me walk normally again. Once it's time to step up on the bike, this is an actual real stationary bike, and I'm not able to do a full revolution, so I just do half rotation, so a little bit forward, a little bit back. Eventually, with enough practice of this, I should be able to go make a full round on the bike. I am basically out of breath and just got over the verge of tears because I'm a soldier Not many people get to see me cry, but physical therapy pretty much kicked my ass just now. We did some lunges off the stair to try to get my knee bending and use my body weight to force action and bending into this knee. And then we went to the therapy room. I got raised up on the bed like we normally do, so my therapist can do the pushing of the knee in and out, kind of like cranking in and out to my tolerance. And then when I flinch, he generally stops, because we know we have reached a point of not being able to get past a certain range. Rolling my knee in towards my butt to get a good bend going. Did about 30 of those. Then we did some wall squats with the exercise ball as well. When I got on the bike, I'm only able to do so much rotation. I can't go a whole full circle around and pedal. So I did them on my own without his help. And then he came over and was like, do you need me to do any like extra encouragement? I was like, no, let me just try this by myself. I'm already like I'm not in like a whole lot of pain, but when I reach the point of no return, when it hurts, I have to like give myself grace and not keep going. So anyway, long story short, my other therapist, who I also see, was there. And I always feel like there's like competition between the two of them, like who's the worst person, who could push me the most. And so the one I have today, he's usually kind of gentle, and he knows that the other one broke scar tissue before and got me through one plateau. So when he sees him walking by, I think in his mind, he's like, okay, here's a moment to like fucking torture her. He puts his hand under the pedal and starts grabbing it and like making a rotation with me, already exerting my body weight down on it. And then he pushed it at a certain point where I wasn't looking and paying attention, because normally I kind of tense up if I see him doing stuff, because your body goes into defense mode. That's just what it does. So while I was not fully engaged, he pushed it to a certain point that I got a full ass rotation and felt tearing in my knee. So I screamed, I yelped like a fucking crazy person, like a loon. And I screamed like a loon. There's like maybe 2 other patients who are around in the exercise room, and other people who are in the PT rooms must have. And then the therapist aide came out. She's like, is everything like they thought somebody fell, died, I don't know what. The point is, physical therapy sucks. I wish I hadn't broke my knee. It's hard, and I'm not gonna cry on camera. I'm gonna cry when I turn this off. But today was hard, so he felt so bad. And then he like iced my knee and he walked me to the car, and he's like, you're gonna be out of commission for about a week. You might need to take a day off and just rest it. And so I'm going home and I'm having a shot, and I'm putting my mask on right now so I can finish crying and have my good soulful cry, because I'm a big baby. And that's about it. I'm ready for this stage of this therapy and my recovery and rehab to be done. It's really hard to get towards the next part of this. And my doctor did tell me, my surgeon, that my recovery could take up to a full year. So I'm ebbing and flowing with the challenges of this being hard.
We don't see you in therapy and do the extra stuff that you can't do to yourself at home. Not breaking your knee in half, nothing like that. We don't want that to happen again.
Yes.
It's bad enough I did it to you, even worse that James did it again. But the passive range of motion that you...
Right. Just bending and bringing it back, right?
Yep, so bend that right knee. Just slightly unlock the knee. And then lock it back out.
We'll test out this one to see kind of where baseline is at.
Unlock the knee. Good, little bend and then straighten. So just unlock the knee and then lock it back out. Straighten back up. Good, perfect. Unlock. Lock back out. Unlock it. Lock it back out.
Oh my goodness. I really thought I was so accomplished at walking at this stage of the game, but now that I'm looking back at this while doing the voiceover, I am dragging my foot like Quasimodo. That's a no-no. Pick up that leg, heel toe is the motion. This is an easy exercise to do. Get yourself an exercise ball, put it behind your back, and do 3 sets of 10 of squats. Look at that right knee. It's really trying to bend. So this is a good one to help practice on and get better and stronger every day.
Come off on an angle. I got this front view. Nice. Congratulations on that one.
I'm leaning a little bit, so there's a slight cheat. Yay.
Nice. That's awesome. And as you extend back, really try to squeeze the thigh as you make that backwards step. It'll kind of force the knee to extend, if that makes sense. Or pretend like you're moonwalking. That might help.
Right. There's a push.
Yeah.
Pushing off when you moonwalk.
Forward today. The other day I went backwards. And I'm saying my foot.
There you go. Get that foot up. There we go. Now start to bring your toe up. Bring your toe up, up. It's gonna be hard. There we go.
Wow. That was the only adjustment I needed.
There we go. Now try to pick up your speed a little.
This is really gonna push it today.
Do it. Pick up the speed. There's no reason you can't pick up the speed. You
I'm
can.
gonna try. I'm gonna go. This looks a little fast.
It is faster.
Am I going fast?
How high is this one?
That is a 8-inch step. So your one at home, generally speaking, is 7 inches and some change.
Okay. Holy moly.
Go ahead.
Yeah. I'm trying to lean back.
Yeah.
Yeah.
And get, oscillate kind of in and out of it.
Okay. Whew. Oh my gosh. Okay. Deep breath. Push back.
Yep.
Yeah, quadricep is it's definitely in there now.
Yeah.
Oh, you feel it. Okay.
Good. And then go again, just kind of in, out, okay?
Okay. Look at this knee, just doing what it's supposed to do.
Right.
For me, other knee, not so much. Okay. And finally, I would like to leave you all with a few words of advice if you're fighting back from a patella fracture, break, repair. No driving until the doctor says you can do so. That's basically when you're back to a 90 degrees range of motion. And then also request your handicap parking temporary permit early. It's because I broke my knee during the pandemic when I wasn't supposed to be out of the home anyway or going anywhere. But later when I was able to drive and start resuming normal activities, I definitely needed the benefit of a closer parking space because by the time I'm done shopping or running errands, it's hard to walk around a huge store and then have to get back in your car and drive. So when you do your in-home PT, basically learn how to navigate the stairs safely, how to go in your bathroom, small spaces, get in and out of a tub with either a lift assist if you have a bath seat, or someone else in the home helping you. I think that would be brilliant. So definitely work with an in-home person or a nurse. Also for food preparation, once you're able to make food for yourself and you can weight bear, definitely keep it easy. Salads, sandwiches, get an air fryer. You know that I'm the air fryer queen, so make your meals as simple as you can, especially if you're home alone. During the 6 weeks of immobilization, stay encouraged. Read books, watch a lot of Netflix. It's going to be boring, but join some Facebook groups that have to do with this type of repair and get advice from others and encouragement and support from others who know what you're going through. And then listen carefully to your doctors, advocate for yourself as well. You know your pain tolerance and limitations, you know what you can take and what you can't take. Speak up, speak up, speak up. But for me, what the future holds is not falling again, hoping my knee doesn't buckle, hoping I don't have to get physical manipulation under anesthesia. That's basically when they crank the knee and kind of break through scar tissue to get more degrees of bending. So I'm trying to take care of myself and do the exercises I'm supposed to do so I can avoid that. I don't want to have my knee opened up again and have another procedure. And walking up the stairs normally, I took that for granted. So I'm ready to walk normally and not do the baby step, the way you should just walk. So anyway, I'm Latrice Kelly again. I hope this has been beneficial for you. Share this video, like and share, and subscribe and stick around, be a part of my family. I'll see you around, and maybe I'll do an update or a part 2 to this video once things get really going, because right now I'm around 100 degrees, so we'll see where things take me.